Hello, I'm Jorge Gestoso. Welcome to a new program. On today's show, how 7 years in the Ecuadorian Embassy affected the health of Julian Assange. Our guest, Dr. Sean Love, who was initially interested in evaluating Assange to study the consequences of prolonged arbitrary detention on Assange's health, and recruited 2 doctors to perform the evaluations, even though he has stayed involved in the process throughout. Dr. Sean Love, a warm welcome to the program.
Thank you very much, Jorge.
Dr. Love, in an article that you wrote on June the 22nd, you said, over the past year, I've met with Assange several times at the Embassy of Ecuador in London. Tell us, not only as a doctor, as a human being, the first impression, the relation. How is Julian Assange?
I was very concerned with Julian Assange, both his condition, his health, and the environment that he was in within the embassy. As a human being, having visited him, and I imagine probably as you may experience having interviewed him there as well, it is a very sad situation to imagine that a man can be confined to such a small space, a cramped space, for so long in the center of London. There is an enormous disparity between the neighborhood in which he resided there and what it was like on the insides of that embassy.
Friendly?
Absolutely. Assange was nothing but professional in our meetings together, and very approachable. He was easy to talk with, understandably guarded regarding his health, understandably guarded regarding very personal questions our team asked him, but always appropriate.
He expected to be there for how long, did he mention? Because in our case, I got the chance to interview him only 3 months after he got in, the end of August of 2012, and I asked him the question, when do you see yourself leaving this Embassy of Ecuador in London? How long will take you?
I think that will resolve in 6 to 12 months. That would be
Your guess.
my guess.
Did he ever mention to you expectations of how long he was thinking to be there?
So when we first met,
Which year was that?
this was 2017. So this was not 6 or 12 months. This was 5 years inside the embassy at this point. I think it is a very difficult situation for him to predict how long he would be there. The UN had ruled that his situation had amounted to an arbitrary detention. That ruling came the year prior to me having met him. That ruling came in 2016. And one of the major issues he was faced with throughout his stay in the embassy was the fact that his detention there, let's say unlike that of a prisoner, was indefinite in nature and had no clear end date.
Stories that he was not washing, and you said, quote, this is a complete smear. This is meant to degrade his humanity.
Yes.
So you never got the sense each time that you were meeting him that was something in that issue?
Absolutely not.
When I talked to him, he was still living in a room that one of the windows was going just facing the sidewalk. And was he also living in that same room when you met him?
I believe so. When I met him, we met in the conference room.
In the conference room, yeah.
That's where the evaluations took place by Dr. Crosby, Dr. Chisholm. And so at no point did I see his living quarters. However, they were described to me. We reviewed a lot of evidence and documentation about his living arrangements.
First evaluation, what you can tell us in terms of were you there or you were just coordinating the evaluation, and in which year it was?
So on meeting him, both as a physician and as a human, I mean, I had several observations, to make about the indefinite nature of his confinement there, about the stress he was under, about the threats to him, and these sorts of things. The evaluations themselves were conducted by Dr. Sandra Crosby and Dr. Brock Chisholm over the period of about 2 years. And so we have discussed publicly, to some extent, findings of the evaluations. However, there are a lot of findings and a lot of materials which, for reasons of doctor-patient confidentiality, have to remain private.
Some information. On April 8th, April 8th, 2019, meaning after the last evaluation that was in February of this year.
Yes.
It was a letter sent to the United Nations and to the High Commissioner by precisely, the High Commissioner was Michelle Bachelet, the former president of Chile, by Dr. Crosby. She said that the conditions of Assange confinement had significantly worsened since her first visit in 2017, and she started to describe things. She said, she noted the severe psychological toll that Assange suffered in his prolonged and indefinite confinement. Also said Assange has suffered a series of deleterious effects of sunlight deprivation, including psychological impairment, weakened bones, decreased immune function, and increased risk of cardiovascular disease and cancer. He has a potentially deadly dental condition that needs immediate surgery. The severe daily pain endured by Mr. Assange is inhumane. He also displayed physical and psychological symptoms as a result of prolonged social isolation and sensory deprivation. So his health was really in bad condition.
Absolutely, and that was apparent upon first meeting him, and I think it became even more apparent his deterioration in his health with these subsequent evaluations. I think the world saw the images when he was arrested and coming out of the embassy, just the qualitative nature of his health at that time.
Precisely, one of the doctors that conducted the evaluation said that in one of the letters that the confinement is, he was defining as torture.
Yes, yes, and that is an assessment that I agree with. I think if you look at the human rights evaluation of his situation, if you go back and you look at what the UN Working Group on Arbitrary Detention determined regarding his conditions there, they in 2016, and this is a point that's largely been lost, I think, is that they ruled that he was being arbitrarily detained in the Ecuadorian Embassy by the governments of the United Kingdom and Sweden, and they called for his release from the embassy and for safe passage from the United Kingdom to Ecuador, where he could enjoy the full rights of his asylum.
Because in 2015, the Ecuador government was asking the UK government to do a safe passage to a hospital so he could receive medical treatment.
Correct.
And they denied it.
Correct.
And it looks like they were putting him as a choice between his rights of asylum, of his rights to take care of his health.
Yes, and this is an impossible situation. It's not one that any person should be faced with. An asylee should be granted the full rights of asylum, and those include the right to access health care when needed. Critics of some of our work and our positions on this area have said, well, he could have stepped out of the embassy at any time. He was there volitionally. However, in response to that, I push back strongly and I say, reference the UN Working Group determination on his situation. He was faced with an extreme circumstance where, imagine, had a health emergency, a true emergency arise. He or his staff, if he was incapacitated as a result, would have had to make this decision. Do we bring Assange to a hospital where he can receive necessary diagnosis and treatment for a condition, or do we stay here in the embassy and see what happens?
These doctors were interviewing him. For example, one of the times was about over 3 days, 20 hours.
Yeah.
To you, again, as human beings, did they comment, rather than talking about health issues, did they comment about his personality, his humor, what we could learn about things extra official about him, the persona?
I would say that my impression, I was somewhat taken aback. You imagine what it's like to be confined in a space such as this for 7 years, no access to sunlight, no access, meaningful access to healthcare, and many other things. In contrast that with his nature, with his, I would say, resilience, with his sense of mind, and with his sense of conviction for his work, I think it sustained him to some degree during his time there, and certainly was in contrast to my expectations on meeting him. So I think Assange is a resilient person. However, I don't think we can overlook the effects at the same time that this prolonged detention has had.
I was reading an article on another doctor, in this case is from Uruguay, studying prisoners in jail, and he said that confinement provokes definitely some serious consequences. And that consequences, he said, some of them could be irreparable.
I agree. I don't think it's a matter simply now that he is in custody of UK police and is in prison there, that while it's true he may have improved access to healthcare there, I don't think it's true that that all of these issues are simply going to go away now that he's outside of the embassy. There is irreparable harm.
Okay, April 11th, he is removed by force by the London police inside an embassy. That is a very questionable issue. And he has been headed in the south of London to a prison that is called Belmarsh. Some people said that he has a reputation, the equivalent of Guantanamo for the UK. Extreme severity. Do you believe that he's going to be having medical care there?
I do believe he will have medical care there. This is speculation on my part. I have not been to Belmarsh prison. I do not have extensive experience working with prisoners in the UK prison system. But as a civilized Western democracy, I would imagine that prisoners in Belmarsh would receive access to medical, dental, and even psychological care if needed. My concerns more, and our concerns, I believe, as a team, is what may happen to him if extradited to the United States, which I think poses a different circumstances.
The United Nations rapporteur on torture was going to visit him on the 25th of April.
Yes.
Is a coincidence that he has been removed before?
It may be. It may be. Dr. Crosby, in one of the things that she did following her evaluation of Assange in February, was actually write to the UN High Commissioner for Human Rights and explain to them the grave situation that she was concerned with, both regarding his health, but also importantly with regards to his right to privacy. She believes that her medical evaluation of him was recorded.
Exactly. Let me mention that because Dr. Crosby said, and there are her words, that the last visit to Assange was monitored by 2 cameras, that she had to speak with him over the noise of a radio playing to mask their conversation because of what he believes there was listening devices in the room. And then she cleared the confidentiality of her doctor-patient relationship has been violated, and she found a hostile, non-confidential, and intimidating environment that she said was palpable.
Yes, and I believe this is different from the prior evaluations that occurred, palpably different for Dr. Crosby, I think, using her own words.
Because of, you think?
Because of the changed circumstances within the embassy.
Okay, the interpretation of the former consul, because there's a new president in Ecuador, and we're talking about Lenin Moreno. He took over on May 2017. He was supposed to be the successor, even politically and ideologically, from President Correa, and he turned around and he became an enemy of the case of Assange. And Fidel Narváez, that has been in the embassy for 8 years, has seen that change, as you mentioned. And he said, the last year he's mentioning about 2017, when the new president came, Julian Assange was put through hell at the embassy. And he said the strategy was very clear, break him down. And the publication, The Intercept, says the new government of Ecuador under President Lenin Moreno, quote, an ally of Trump in need of IMF loans, cut his internet and telephone access, restricted visitors. Yes. So most definitely he has been, if you want, increase the torture of a person that has already been tortured according to the law.
Absolutely. These policies instituted by the state of Ecuador on Assange, beginning in roughly May of 2018, when his access to communication, access to internet, access to visitation, and all of these things were restricted. He was placed in what, for instance, Human Rights Watch has called circumstances that amount to solitary confinement.
Precisely, there were comments that they could be similar to the one going through what today's Chelsea Manning at that point was Bradley Manning, the person who leaked that information, troves of documents of the U.S., and that was the beginning of the whole issue. And then say, and now Chelsea Manning is here in the outskirts of Washington, being also detained, believed in solitary confinement, in order to force her to testify against Assange for the second time.
And that's also rather alarming to us and points to evidence to Mr. Assange's credit for which he sought asylum with the state of Ecuador in the first place. According to him and his application for asylum, his case was never about what was to happen in the UK or in Sweden. His case was always out of concern for his safety and his legal status if brought to the United States. And I think Assange also had, and we as well, had a very clear understanding of the risk imposed on him if he were to come to the United States. One need only look as far as his alleged source, Chelsea Manning.
Well, when I talked to him, and we're talking about 7 years ago, he was absolutely aware there was a secret indictment in Virginia, and even a secret jury. And the thing is, even though so far the extradition from the U.S. government is talking about the charges of conspiring with Chelsea Manning about hacking a computer and download information. The fear is that once that he's here, he could be, for example, charged with other charges like espionage, and according to the law, he could be sentenced to death or life in prison. And that's also part of the anxiety that he was living, no?
Absolutely. And I think we also have to draw a distinction here between the UK court and the US court, the UK prison system and the US prison system. For instance, the European Council on Human Rights has spoke openly about the US's use of policies, prison policies, for instance, of solitary confinement. And one, again, only needs to look so far as to the treatment of Chelsea Manning to imagine what that would be like for Assange.
One of your tweets, quote, "I'm concerned that Assange treatment set a precedent for asylees elsewhere. Ecuador's decision is an affront to international law. Political asylum cannot and must not be revoked based on a change of political opinion." So basically, here is a political issue in the middle.
Absolutely. This is concerning, I think, not only for the rights of Julian Assange. I mean, obviously, there are debates here over First Amendment principles in the United States. However, I think this issue also raises certain international human rights concerns when you look at Ecuador's motion to revoke the asylum of somebody that it granted that status to several years prior. And when it appears that the threat upon which that asylum was based has not been removed. And really the only change here is a change in the domestic politics of the country.
What are you going to do with all that information that you got, those evaluations?
Yeah, so obviously one of the things we have seek to do is to inform the international community, especially the human rights community, regarding our concerns over Mr. Assange. His lack of appropriate access to healthcare while in the embassy, his lack of appropriate access to, or rather respect for his privacy while in the embassy. And I think moving forward, we need to have as part of our discussion the effects he may, or rather how his situation may be exacerbated, how his health, physical and mental, may be exacerbated if he is brought to the United States.
Dr. Love, at the personal level, what is the most striking experience that you got from all this being exposed to the case of Assange?
I think it's scary, above all else, to imagine that a person for his work in exposing government or corporate malfeasance issues, can be subjected to such treatment, and can be subjected to such treatment in a place as prosperous as the City of London, where he can be, in some cases, hundreds of yards from a hospital, where he would receive world-class treatment if he could only go there, and to be systematically prevented from doing such a thing.
Thanks very much for joining us.
Thank you.